Hi, this is Sarah Reese from Polk County Public Health here to provide you with a COVID update. It is National Public Health Week, and we are super excited to celebrate all of our local public health, state, federal, and folks across the world that work in public health. We don't do this work alone, so we'd also like to acknowledge our healthcare, community, business, and school partners. I'd like to give a special shout out to Polk County Public Health employees and Norman-Mahnomen Public Health employees who I work with day in and day out. Thank you. You are true rock stars. Next, I'd like to take a moment to talk about vaccines. Vaccine is becoming more readily available in our region and specifically across Polk County with the vaccine providers, which include Polk County Public Health, our healthcare partners, and our pharmacy partners. If you are eligible for vaccine, meaning that you're 16 years or older, I would encourage you to schedule your appointment to get your vaccine. You can schedule that directly with your healthcare provider, your pharmacy, or you're always welcome to come visit us at Polk County Public Health. We have a convenient website link at our Polk County Public Health website where you can choose a day and time that is most convenient for you. With the vaccine being more readily available, we have a few frequently asked questions that I'd like to spend a little time visiting with you about today. The Minnesota Department of Health and the Centers for Disease Control and Prevention are continuing to evaluate the recommendations as more people in the community are becoming fully vaccinated and also as they look about the spread of disease. With that in mind, if all people that you're spending time with are fully vaccinated, is very likely that the risk to spreading disease is small. So with that, if you have been fully vaccinated, and what that means is that you've had the complete series. So for the Janssen vaccine, you would have 1 dose, and for the Moderna and Pfizer vaccine, you would have 2 doses to be fully vaccinated. So if you are fully vaccinated, you can gather indoors with small groups of other fully vaccinated individuals without wearing a mask. That's been a question about, do we still need to continue wearing a mask if all people in our party or group are fully vaccinated? So you can gather without wearing a mask. We do recommend that you still continue to avoid large group gatherings where folks are unmasked, and that's because we have variants that are circulating across the nation, Minnesota, and our region, and we are still evaluating the spread of disease. So wearing that mask is still important. In addition, Minnesota does still have the face covering requirement. So this means that some places that you go, you will be required to wear a face covering. So the question has been asked, is there an exemption for people who have been fully vaccinated? And the answer to that is no. The Minnesota's face covering requirement is still in place, and it does not include exemptions for fully vaccinated people. Next, there's been questions about quarantine. So quarantine is the strategy that we use for individuals who have been exposed to someone with COVID. So the question is, if someone is fully vaccinated and is exposed to someone with COVID-19, do they need to quarantine? And the answer is sometimes. So if all of these things are true, then you would not need to quarantine. And those things are: the COVID-19 exposure was at least 14 days after the vaccination series was fully completed. So if I'm on day 15 from when later from when I've gotten my vaccine series completed, then I do not need to quarantine. And the other important part is that the individual should not currently be experiencing COVID symptoms. So if there's symptoms, or if you aren't 14 days post your series completion to be fully vaccinated, then we would be asking you to quarantine. And last but certainly not least, we've been having questions about travel. So people who are fully vaccinated with an FDA authorized vaccine can travel safely within the United States. Fully vaccinated travelers do not need to get tested before or after travel unless their destination requires it. Fully vaccinated travelers do not need to self-quarantine upon return, but we do ask that you still continue to self-monitor for symptoms because there is still the potential of exposure. Also, if you're unaware, there is a federal requirement that masks are worn on planes, trains, buses, and any other form of public transportation. So that is an expectation if you use that mode of travel. And lastly, the international guidance does vary a bit from the domestic guidance. So I would recommend that you check the Center for Disease Control and Prevention or the CDC website for further guidance if you are planning international travel and are fully vaccinated. Thank you.